My name is David Fralinger. I'm one of the fifth-year orthopedic residents here at UIC. I'm here with Dr. Malhotra. Dr. Malhotra is one of our hand faculty. He's been with us about 5 years. He did all of his training here in Chicago, decided he wanted to stay, and came to work with us at UIC. He's been a great addition to the program. So thanks for being with us, Dr. Malhotra. What drew you to hand surgery?
Well, I was initially drawn to hand surgery first in medical school and then residency, principally because I found the anatomy fascinating. The anatomy of the flexor mechanism, the extensors, the carpal bones was all very, very interesting to me. Subsequently, I learned about the pathology. That was also fascinating, and tying into that, the treatment that we have, the surgical options in hand surgery are very intricate, very diverse. You can literally do 20 different procedures in a week and come in next week and do 20 different procedures. And so I think it's very tough to get bored, which I find, which is great for me. And you're always learning. It's impossible to master all of the procedures in hand surgery. And so I feel like I'm constantly challenged, I'm constantly learning. And that really keeps me interested and excited about hand surgery.
Can you tell us about the hand surgery experience that residents get here at UIC?
So I think the residents get a very robust experience as far as hand surgery goes at UIC. On this campus, we have Dr. Mejia, Dr. Gonzalez, Dr. Mass, and myself. At North Shore, the residents work with Dr. Gray. And then at Christ and Lutheran, which are both level 1 trauma centers, there's a smattering of fairly severe hand traumas as well. And so it's quite a robust experience. The residents get that experience anywhere from a second year to a fourth year and a little bit in the other years as well. And so really you get introduced to simpler surgeries as a second year, and as time goes on, your skills grow and you get to be a part of and really perform the more complicated cases. A lot of our residents end up going into hand surgery as their fellowship option and their career option, which is great. But even the surgeons, even the residents who don't end up choosing hand surgery, I think gain a lot of skills, both in terms of understanding form and function and anatomy, and also the finer skills, not just microsurgical, but just your fine motor skills really get honed during the hand surgery experience.
Yeah, Dr. Malhotra, I really agree with that. I think that I've gotten a very strong experience in hand surgery here at UIC. I had all of the UIC residents have the opportunity to work with Dr. Maria Simino in her laboratory doing microsurgical training, in which we do a microsurgical anastomosis on femoral vessels of a rat. That was really interesting training, and it made me very comfortable doing microsurgery in the real world. And what do you like about working with the residents here at UIC?
I think my favorite part is watching the residents grow. So they first come in my rotation as a second year. I then work again with the residents as a third year and a fourth year. And just seeing the progression in knowledge, in maturity, and surgical skills. When you enter as a second year, you have excellent clinical knowledge, but are just learning surgical skills. And by the time residents are in their fourth year, they're comfortable even with complex microsurgical cases that they need to do in the middle of the night. And so watching that growth, watching that progression, to me is very exciting and very rewarding.
So the best thing about UIC is the people. I feel very close with all of the residents here. It makes me sad to think about a few months from now graduating, but I know I'm going to keep in touch with everyone because I've become such close friends with so many of the residents. We have a big program, 35 people. That's great when you're moving to a new city to know that you're going to have that many people kind of within your circle. And additionally, I think UIC, another huge strength that we have is the different sites that we go to. We really go to a wide variety of different sites, and that really prepares us for almost any clinical experience. You'll see how things are done very differently at different places. I think that's a huge advantage for us. And what do you like about Chicago? What made you stay here?
Well, Chicago is a phenomenal city. I think there's something for everyone in Chicago. My personal experience, I'm married, I have a young kid and a dog, and so there's a lot to do as far as family life goes. There's a lot of opportunities for kids in terms of museum, outdoor activities, sports, and as a relatively young person, I still get to enjoy the restaurant scene, the nightlife, soccer, golf, a lot of gyms and activities, some of it curtailed by COVID, but all of it that's there in Chicago for the offering, and I find that all is great for my life, and all of that's there in Chicago, and I take advantage of that, and I love living in the city.
Yeah, I really agree with you, Dr. Malhotra. I think Chicago is great. There's really a lot to do. You can have a really great life here on a resident salary. It's affordable. I also think that Chicago is really the center of the world when it comes to orthopedics. AAOS is headquartered here. They have a huge facility in Rosemont. Arthrex, Stryker, both have facilities in Burr Ridge. Basically, all of the vendors have facilities here in Chicago, and we actually take advantage of that. We have labs at these facilities. Cadavers are provided. We get to sometimes play with implants before they're even available, and I think that that's an experience that you may not get in other cities. Okay, so thanks so much, Dr. Malhotra, for being here with us, and thank you to everyone who's watching. We hope to see you soon for virtual interviews.
Oh, it was my pleasure, David. Thanks for having me.